Hi, this is Amanda.
And this is Jen.
And you're listening to Just This, a podcast that explores everything around being and becoming a mother or parent.
We're excited to have you join us as we dive into the practical details as well as the unseen energetics on topics that span from preconception to years after birth.
So today we have with us Brynn Babb, who I'm really excited to talk to. I've been wanting to have a pelvic floor therapist to chat with on the podcast for a while, and we found each other online. I actually found you through Instagram, which is such a rarity for me, to be honest. But your content was so juicy. If anyone's listening to this, go check out Brynn's Instagram content because it's very digestible, very relatable, just really fun content. And sometimes I know pelvic floor therapy cannot be like a super juicy, fun topic, but it's really important, which is why we're having this discussion. And I really wanted to have you on the podcast. But you really brought this levity. It was so inviting. It made me like want to jump into doing pelvic floor therapy for myself and whatnot. And I think that's really important, especially when we're talking about pregnancy and postpartum. It's not just one more thing on your to-do list. Like you're really bringing a lot of understanding and just fun to the process. So yeah, I'm excited to jump into things today. Do you want to introduce yourself at all or give like some small background of how you got into doing this? And then I have obviously a lot of questions that we can jump into.
Yeah, of course. I'd love to introduce myself. Like Amanda mentioned, my name is Brynn Babb. I am a physical therapist and I've been specializing in pelvic health for over the past 7 years now, working through the whole timeline of pre-pregnancy, during pregnancy, and postpartum. I'm really passionate about helping women overcome pelvic floor issues like bladder leaking, pressure, pain, and helping women realize that with the right support, a lot of these things can heal. And you don't have to accept that these pelvic floor issues are just a part of motherhood or just a part of getting older, because they are very common things that you can treat. I do a lot of my messaging on Instagram. I love connecting with my followers on there. So if you follow me, I will probably send you a DM because I think it's important to just start these conversations about pelvic floor issues. And in my world, nothing is too much information, but I also recognize that talking about these things can be embarrassing or shameful or feel weird, or some things can get really heavy. But I like to just approach that conversation with curiosity and create a space that feels comfortable to talk about these things so that we can make a change and move forward in our healthcare and our pelvic health care.
I love that. And I love like your mission and philosophy behind that. I'm so curious. I think it's 50-50 when I'm talking to people when they're pregnant and they start to see a provider of if the provider even mentions pelvic floor therapy at all. It's one thing when I talk to clients, I'm like, you should definitely do it, especially postpartum. But honestly, and what I've heard from most pelvic floor therapists, what's most beneficial is to actually start seeing or working with somebody during your pregnancy prior to postpartum. Do you want to speak into that a little bit of what your thoughts are on when somebody maybe should reach out? Like at what point in pregnancy would you want to start working with somebody? What the benefits are of starting to work with somebody during pregnancy? You know, obviously, if you're already in your postpartum, now is the best time. It's always good to start, even if you didn't start working with somebody during your pregnancy. But if you are pregnant or planning on getting pregnant, the benefits of potentially starting to work with somebody while you're pregnant versus postpartum solely, like waiting until these issues are coming up in the postpartum. I think sometimes people are like, everything's fine, everything's going to be fine. And then 4 weeks after having a baby, they're like, my whole body and life is different. But really, sometimes it's like if you start a little bit of this care prior, that actually can really make some big benefits of how things unfold after the baby comes.
Yeah, be happy to talk on that. First, I just want to say that if you're seeking out pelvic floor care after giving birth postpartum, it's never too late. So if it's been a couple of years, a couple decades, I think of postpartum for life. I don't know. I feel like sometimes the definition is skewed. Like some people think it's like, oh, just the first couple months, but in my books, postpartum is for life. If you had a kid, then afterwards you're postpartum. But if we go back to like your original conversation of in an ideal world, if you can work with a pelvic floor therapist during your pregnancy, I generally recommend about halfway through, so that 20 to 25 weeks. During pregnancy, your body is going through a lot of changes. The musculoskeletal system is going through a lot of changes. And so a lot of aches and pains might pop up. And I think people think that just because I'm pregnant, my body's going to hurt, but that's not the case. So working with a pelvic floor therapist during your pregnancy can help minimize those aches and pains and help you figure out different strategies to help move throughout your day as your bump gets bigger. And then depending on what kind of birth you want to go for, vaginal or C-section, we can start working on some birth prep stuff. Basically how to get the pelvic floor ready for birth, going over different positioning and breathing techniques, which I'm sure you also go over similar stuff with your clients. And then one last benefit of working with your pelvic floor therapist starting in pregnancy is you're creating this relationship during this one stage of life and you're like building a baseline. And then when it comes to postpartum, you've already built trust and you feel more comfortable working with this person because they already know you. And then they know you like pre-birth and then after birth to compare and contrast and measure things. In an ideal situation, if you could start working with a pelvic floor therapist in like your second to third trimester, that would be great. And then continuing that care postpartum.
How frequently are you working with people? Is it like a weekly thing or like a couple times a month in pregnancy? Just curious as far as what like the frequency of that goes.
Yeah, so it's going to be different for everyone depending on what's going on with their body and what they need. I provide all my care 100% digitally. I meet with people over Zoom, over live video, either once a month or once every 2 weeks. But in between those live videos, we're messaging in between there. So there's always this steady support of care if you're working with someone digitally. I will speak on the fact if you're going to go see someone in person. I used to see a lot of people in person and then switch my model of care. When I saw people in person, I was seeing them about every 2 weeks.
Okay. Yeah, let's talk about that digitally versus in person because I'd love
hmm
to get your insight on this. I personally think digitally where I'm located is such a benefit for people because I'm in a city where people have really busy lives. There's very little parking and just all the things. And I think the in person has a lot of benefits. And I think the accessibility of digital care in this way is something that was new to me. Like, as far as being able to, somebody thinks like I have to go to an office, and then oftentimes I associate it with hands on, hands in
hmm
care. And I think there's two things to this. One, it's more accessible to people. And two, like you brought up the shame or people who might be dealing with trauma or things like this, either pre birth or post birth might be a little bit more turned off on working with a hands in, hands on practitioner for these reasons. But I don't know from your experience, obviously you have experience in both. If you want to speak to a little bit of the benefits of working digitally, the downsides, and maybe the hybrid of having the two together, that kind of thing too.
Yeah, would love to talk about that. Like you mentioned with the digital care, it removes a lot of barriers. No traveling, no balancing your schedule, your kids' schedules. Like you said, navigating traffic, parking if that's an issue. And then in just some communities, there's no pelvic floor therapist close by, or people have to drive an hour or so. Doing this digital care just increases the accessibility exponentially. The downside of digital care is there's not that hands-on component. What I saw over my time of working in person in the clinic and then transitioning to fully digital is that hands-on care can be really beneficial. It's not necessary for everyone to get better or to improve their pelvic health. Through digital care, we can get really creative by using different tools and techniques that like I can teach you how to do to yourself, which might be like a little bit more comfortable to do in the privacy of your own home. So it really is what you want to get out of it. If you're in a place where you want to go into a clinic and see someone and you have that to you, then go for it. I think having a hybrid kind of style would be ideal, where it's like you see people in person every so often, but then there's this digital support on the other end. But the biggest thing for me with going 100% digital is to just increase that access to care and then just to be able to help a wider audience of people versus just where I'm located.
I can imagine it's more affordable in some ways as well if you're paying out of pocket, depending on where you live, but it can be pretty pricey, especially if you're going weekly to see somebody. Oftentimes, I see people go once during pregnancy, maybe twice, and then same like once, maybe twice postpartum. And a lot of times it comes to what their insurance covers. Or like what they're wanting to pay. I think the benefit of having one or two visits, it's great. But like you said, postpartum is for life. I like to say those first 2 years, there's so many changes, not just to baby, but to your body as it's bouncing back and lactating and like all these things that it's going through. And so it's nice to have some kind of like touch in and continuation over at least the first year, I feel like, if not a little bit beyond that. Do you want to speak to that on the postpartum end as far as continuity? I don't know.
Continuity of care.
Yeah, of care and the like duration as far as the amount of months and what you find as beneficial. I know a lot of people sometimes just want this like quick fix, and I think there's so many layers to adjustment over the multiple months. And I'm sure, like you said, you customize your care, and so you can increase or decrease frequency. But generally, how long do people work with you for, and like how does that generally look on your end, or like what would you recommend as far as anyone seeking care, how long they work with a practitioner for?
In the postpartum period, I'm seeing someone anywhere from 3 to 6 months, maybe longer than that, depending on, again, what is their baseline of their pelvic floor, what kind of injury did they sustain during their birth, and like what their long-term goals are. So I tend to work with a lot of active women who are wanting to get back to some higher degree of performance. So recreational running or running races or weightlifting or Pilates. One of the biggest things that I hear about returning to those sports after baby is they don't want to do it or they're having pelvic floor issues during it. So like leaking, pressure, pain, and it just makes it not fun anymore because they got this like mental load on their plate of, oh my God, if I'm going to go into this workout class, am I going to pee through my leggings or whatnot? Timeline will vary based on what the long-term goal is, but I always like to stress that, like you mentioned, there's not a quick fix, but when it comes to helping your pelvic floor heal after your birth, working on this sooner than later is going to be ideal. And just even knowing that there's care out there. If I think about long term, like a woman's life down the line, eventually we're all entering into perimenopause, menopause, and even in our geriatric ages, one of the biggest reasons people get admitted to skilled nursing facilities is because they have urinary incontinence. And yes, there's other factors that can contribute to that in geriatric age, but if we can start working on it in these reproductive years and like closer to when the injury happened, then I feel like we're just going to promote a long-term better outcome over the span of a woman's life.
Yeah, 100%. The whole philosophy behind the first 40 days, and there's multiple names for it throughout the world in different cultures. But it's that when you've given birth, you are blown open. And it's really this time that you have the opportunity to adjust all these things in your body and healthcare. If you take care of yourself in these 40 days, or even like I say, the first year after post birth, when you really tend to your health, a lot of the philosophies are what you're doing in that year is going to affect you 40 years later. Like you said, when you enter menopause or when you're in your 80s and you're going through other changes in your body. So that they say these post-birth windows are actually real portals to adjust that for yourself from a lifelong standpoint. So I love that philosophy and look at it. There was another question that came up as you were talking about that. It's interesting you work with a lot of people that are more athletic. Do you tend to find that people come after they have re-entered trying to do their whatever chosen sport or athletic endeavor is, and then they realize that they don't injure themselves, but then they end up having issues because they jump into
Hmm.
it too fast. Is that tend to be
Hmm.
what you have versus people who are trying to be smart about it? I don't know. I would imagine most people out there that I have interacted with don't take the preventative approach sometimes. They're just like, they just want to get back to it. And I feel like our culture really pushes people to just get back to normalcy. Do you tend to find people that have tried to do that and then are coming to you saying help afterwards?
Yeah.
Yeah.
Yeah, it's kind of a mixed bag. A part of my Instagram is just to raise awareness and have these conversations. So if I am working with someone before they return to their sport and before these issues pop up, that's ideal because we're being proactive. But yeah, I see a lot of people after they return to their sport, or they're like, I can't go over lifting the certain amount of weight because I know I'm either going to leak or have pain, or it's like I can only run 1 mile before I have issues. A lot of people are plateauing in their sport. Their pelvic floor is an underlying common denominator. I've seen both where people come in proactive. Again, that's the ideal situation, but recognizing that's not always realistic, and that's okay. Then we can work on this afterwards. It might just take a little bit longer.
Yeah. And this is a good note for anyone out there listening who is active. Again, start in pregnancy because
Hmm.
you'll be able to continue doing, even through your pregnancy, what you are already doing longer when you're incorporating these exercises, like you said, or like incorporating this guidance because the pelvic floor is at the core of so much of this. So you mentioned urinary incontinence. I'm just curious, what are some of the other big things? We'll start with the athletic side that people come to, like maybe they re-entered doing a sport too soon
Yeah.
before the pelvic floor was in a stabilized place. What are some of the biggest uh-ohs that people come to you with due to that kind of an issue or situation?
Yeah. So like you said, urinary incontinence, bladder leaking, that's a big one. Any pelvic pressure or like pelvic heaviness. So that could be due to a prolapse, or it could be due to a non-prolapse thing. Pain with intercourse and intimacy and insertion is another big thing that I see in the postpartum phase. And then chronic hip and low back pain that hasn't gone away with your more traditional treatments.
The prolapse, I'm kind of curious, let's go there because I think
Yeah.
that's a big one.
Uh-huh.
Do you feel that prolapse can be solved with pelvic floor exercises and care?
Yes. I guess when you say solved,
Yeah,
are you meaning like no
resolved.
symptoms from it?
What's your experience? We'll just go there. What's your experience? Because I personally do believe that with the right care, you can resolve in some
Hmm.
ways a prolapse. Where I know there's others out there. I've had people say, "Oh, doctors have told me that the only thing I can do is have surgery,"
Yeah.
which I call bullshit on.
Hmm. Hmm.
Um, so I'm curious if you want to go into that because I think again there's a lot of misinformation and then people they don't know what they don't know. I actually just learned last year that there's three different kinds of prolapse and
Hmm.
got to do some in-depth training around how to do a either an assessment on somebody and or have them self-assess like what kind
Hmm.
of prolapse it is and based on the type of prolapse that's obviously going to change probably what you're doing in your body to try to resolve that prolapse. So there's all these nuances that
Hmm.
doctors won't even tell us, I think, sometimes. And yeah, I'd love to go into that because I think prolapse is not uncommon and
Hmm.
something that people don't even know there's options around it out there.
Yeah. Yeah, real quickly, if we define prolapse, it's basically one or more of the pelvic organs has shifted down and is moving into the vaginal canal. With the female anatomy, there's three pelvic organs. There's the bladder, the uterus, and the rectum. So one or all can move down over time. Vaginal childbirth is one of the biggest risk factors for having a prolapse, but it's a really common diagnosis, and people who have never been pregnant or postpartum can also get a prolapse. We measure the prolapse is in stages or degrees, 0 through 4. 4 is the worst. That means it's like really down, it's like protruding out of the
The vagina.
vaginal opening. And then usually the typical symptoms with a prolapse, heaviness or pressure or a falling out sensation.
Mm.
What's kind of unique but can also be confusing about prolapse is the grade of it doesn't always equal the symptoms. So someone can be diagnosed with a grade 1 prolapse, so very small downward motion, but they are so symptomatic and their body feels like shit and they're all heavy all the time. Whereas if we flip it, someone could have a grade 4 prolapse. This organ is out of the vaginal canal, but they don't have symptoms and they're fine and they're living their best
And
life.
symptoms
So,
is like just them feeling it, right?
yeah,
Yeah.
yeah.
Okay.
So that sensation of heaviness or a bulge or the falling out. So as a pelvic floor therapist, I do conservative care. So yeah, again, not doing surgical. Research says that conservative care, like physical therapy, can reverse a prolapse grade by 1 degree. Okay, so we can go back one. We just can't go put the organ back to where it started and it's like pre-pregnancy state. But the way I approach it is I want to address the symptoms. Going back to the original question of can you heal a prolapse, you can most definitely get rid of the symptoms.
Mm.
If we do this physical exam and I have you bear down, there might still be this little bit of a protrusion or a downward motion of the organ, but and that's still going to be okay. But if you're totally 100% symptom free, that slight downward motion is really not a big deal. And because we've treated your pelvic floor and your abs and your breathing muscles and treated the whole system, everything's working together more efficiently to better support those organs. I focus more on the symptoms versus the actual grade of it.
Do you find that over time, so let's say that somebody is kind of incorporating these exercises, and then if they continue them over time, like over years, that with that support, that the organs would eventually shift back to where they're meant to be? Or generally, like there's always going to be, like you said, that little bit of movement?
Yeah. So most likely there's probably just going to be a little bit of that motion. Again, we can't put it back to like where it started. So yeah, there's likely going to be this little degree of motion, but if you know how to better support your body and your muscles, then you're taking these principles and you're applying them to like your workouts and your day-to-day activities, and that will help just provide this long-term support.
Generally, do you feel like surgery is needed in these situations? Is there a point where you're like, okay, if you have a grade 4 prolapse, then oftentimes surgery is involved, even with the pelvic floor assistance and therapy as well?
Yeah, so surgery is always going to be an option. Do I think it needs to be the first option that someone rushes into? No. I would do a good bout of conservative care with like pelvic floor therapy and work on the whole system that way first. There's also these insertable devices called pessaries that can help support the prolapse. And then I would say if after you've given pelvic floor therapy a good shot, the pessary isn't really working, then yeah, then considering surgery is like the a good viable option.
I think for all of this too is all the more reason to start if you can when you're pregnant, because I'm setting the foundation, but also by like practicing the pelvic floor strengthening and releasing. I think that's another big thing. We didn't talk about that, so maybe we can talk about pelvic floor releasing.
Yeah.
But by practicing this during pregnancy, you're setting your body up to hopefully less likely have these issues in general, but like prolapse is a big one too. Go
Let me
ahead.
touch on that real quick. I guess one thing to remember about prolapse is it just doesn't happen like overnight. It's a gradual thing that builds over time. And sometimes we get into these habits where we're straining to have a bowel movement. And if we're like always straining, that's not helping the situation. In a perfect world, if we can start earlier and you kind of learn these tips and tricks to better support your pelvic health over time, that might help decrease some of these extra variables that might contribute to a prolapse.
So that's interesting. Basically, you're saying that it's very rare that maybe somebody would get a prolapse just from the strain and pushing of birth. That it's probably there's factors that have led up to it before birth, such as all during pregnancy, like straining to have a bowel movement. And then, of course, the birth might exacerbate it more. And so
Mhm.
it's more visible or obvious, or the symptoms might present more. Is it possible for somebody to just get prolapse just from birth, vaginal birth?
I guess depending on how the birth went, if you're pushing for 4+ hours and there's instrument assisted like vacuums or forceps, then yes, in that scenario, someone might develop a prolapse after that. There is also the scenario, like you mentioned, where there's these little drops over time and then they all accumulate, and then you have a birth and it compounds on itself.
Okay. Yeah. I was just curious. What are things to look for, I guess, as far as are there small signals or symptoms that one could know, especially in pregnancy, of have minor signs of a prolapse
Mhm.
developing or being present? Or is it just
So,
really hands-on, hands-in to be able to tell?
during pregnancy, you might have pressure or heaviness down there, but you could also have pressure and heaviness without there being a prolapse there. So in pregnancy, it's hard to say. But if you were to take a mirror and kind of do a self-exam and look, and if you notice a bulge of the tissue, that's another way you can just self-check. And that would be more of a visible sign that it's okay, there might be like a little prolapse here.
Yeah. Or feeling inside the vaginal
Hmm.
canal, kind of
Hmm.
feeling all around. And if it feels like there's some kind of, yeah, like protrusion or
Yeah.
something's pushing on one side of the vaginal canal, right? That's maybe a potential indication as well, right?
Yeah. I've often heard like when people are wiping or they're cleaning themselves in the shower, it's like when they like wipe over the area, they might feel like something at the opening.
All right. So we've talked a lot about prolapse.
Hmm.
It's an interesting one because, again, I think it's one that people don't talk about as much. People talk about the incontinence a lot. I think that's become more widely accepted. And just going back to what you said originally, like none of this stuff is normal. Love that too, because I do think there is a sense in our culture of, oh, it's normal. Yeah, pee a little bit when you sneeze or whatever after you give birth. And it's like, well, no, that generally is not a normal thing. And we can like
Hmm.
come back to a more midline with the body. I want to kind of shift to sex because I think that's the other big
Okay.
one that doesn't get talked about. And people are afraid to talk about it and also don't realize that's actually a pelvic floor issue or can be a
Hmm.
pelvic floor issue as well. I don't have any specific question to start with, but do you have people come to you, I guess, for sexual pain if you want to just take it from there? Like, what tends
Yeah.
to be the things people come to you around that? Or do people not come to you and then just unfolds as like a secondary thing? But I think a lot of people sometimes think, oh, it's just going to be painful for a while and then it'll
Hmm.
get better. And that's not really, oh, that's not the case. If there's pain during sex and in your thoughts, my experience personally, and then what I've witnessed with my clients is like, yes, the first time you have sex after you give birth, it's going to feel weird, depending on how long you wait. If it's especially in those first 6 months, it won't be painful, but like for me, it felt like I was like a virgin again because the tissues are just like they're still tender, like, and they're
Hmm.
also holding the experience of giving birth. And so there's a lot of, I think, emotional release that comes with that. I always recommend actually people do a Yoni massage or some kind of connection with those tissues. Pelvic floor therapy is a great way to connect with those tissues before having vaginal intercourse. I think though people when they have pain during sex are like, "Oh, this is just how it's going to be for whatever a year and then it's going to go away." That's not really how it works.
Yeah. Yeah. So if after the first handful of times it's still not comfortable or enjoyable, then you most definitely have to consider the pelvic floor as part of the issue. Like you mentioned, you can't disregard the spiritual, emotional, mental side of kind of what has happened in this area. But I'll speak more on like the physical, like muscle perspective of how that might contribute to pain with intercourse. So yeah, this can happen after a vaginal birth or after a C-section. Usually what I'm seeing is there is a certain degree of pelvic floor tension or tightness that is blocking insertion or making insertion more difficult. Or what's also been described is with like deeper penetration, it might feel like it's hitting a wall. And that's usually just the muscle, the deeper muscles are just locked up. And then if there is a vaginal birth, there might be scar tissue from like perineal trauma, or sometimes you can have tearing off to the side or going up to clitoris. And then lastly, if you're
Just a note on that, even with C-sections, because scar tissue is a web. So like people
Mhm,
sometimes think like, oh, I had a C-section, so the scar tissue is just very local, but
mhm.
actually like it can go deeper into the pelvis,
Yeah, for sure.
and affect like pelvic floor from just a C-section as well. So yeah.
Yeah. So whether you have a scar across your lower abdomen or you might have a scar vaginally, ideally, once the time is right, we are massaging that area to get the tissue moving better. But then it's also important to remember that if you're like pumping or nursing, sometimes our hormones can play a role
Mm.
and estrogen can play a role with pain with insertion, just because the tissue that's right around the vaginal open is different than what's deeper in the vaginal opening. And so what's right at the opening needs a lot of estrogen to be like plump and moist.
Mhm.
And typically during breastfeeding or pumping, estrogen's going down because that's
Yeah.
what's allowing breast milk in. And so that's why that area right at the opening can get really dry and like sandpapery. So if you are breastfeeding or pumping, there's ways to work around that. But yeah, pelvic floor tension, scar tissue, whether that's in the abdomen or vaginal, vulvar, potentially this estrogen factor with the tissue there, the big three that I see that cause this like physical pain during intercourse.
And so you're saying if it's more toward the outer labia, that it's usually hormonal, which probably with that is a simple solution of just using lube more, right? Or like for the time being, I would
Mhm.
imagine, right? Is that what?
Yeah, lube can be helpful, or you could talk to your birth provider about getting prescription topical estrogen. So it's basically just like a cream that you rub around the opening to provide that layer of moisturizer. But yeah, that's a prescription. So like a medical doctor or a nurse practitioner would have to
And
prescribe
then
that if it's appropriate for them.
the deeper pain tends to be more related to pelvic floor, right?
Mhm.
I'm curious with that, like how long does it take when they start to do work with you before potentially sex becomes enjoyable again? Like what
Mhm.
generally is an average duration? I know it's probably varies based on the person and the situation. What generally is a turnaround point where people are like, "Oh, I'm actually finally enjoying intercourse again," for the
Yeah.
like deeper level stuff, like the deeper pelvic floor related stuff.
Yeah, probably on the shorter end, probably within a month or two, but then on the longer end, if there's other kind of factors going on.
Like longer and being like 6 months or sometimes a
Six,
year.
9,
Okay.
but those kind of scenario, there's probably
Other layers.
layers
Yeah.
emotionally, spiritually, mentally. Maybe this was going on pre-pregnancy and they've always just had a long history of pain with intercourse.
Mm,
Maybe there is some type of trauma.
yeah.
So that's where working with other providers, such as like a mental health professional,
Yeah.
can be helpful for helping that person in that situation.
Totally. Do you often have referrals for people when they work with you? Hey, like this might be a complementary therapy to do. I know with an actual therapist, like it's state by state, so that's probably
Mhm.
harder. But generally, I don't know, if somebody's working with you and you're like, this could be a complementary therapy, do you refer out to other things too?
Yeah, I have no problem referring out. I would rather approach this as a team and work with
Mm,
someone else who this might be more in their scope. When I was in person doing in-person care, I had a handful of referrals and even worked alongside mental health professionals. So yeah, as a physical therapist, we can talk about some nervous system and mental health support, but there's a limit in my training as a physical therapist, and
yeah.
I really try to recognize that and have conversations with people of maybe it started off mostly physical, that their
Mm,
pain was physical. And we've worked together and we got them better to a certain degree, but there might be this like lingering pain that's going on. And based on how the assessment goes, it might be like, hey, I think it might be a good idea to start thinking about bringing someone else onto the team. We've done XYZ together and you've gotten better, but there's still this last hurdle to go get over. We might need to consider other options.
There's two more things I want to go
Mhm.
over. You have mentioned before myths, and so I'm
Oh
curious
yeah.
about that. If you want to talk about like pelvic floor myths that you find that are out there. And then, yeah, I'd love for you just like at the end, just so people can get an idea of what working with you looks like. For me, even I was like, oh, how does it look to work with somebody virtually? Just like a brief overview of, oh, this is how we do an assessment. I generally meet with people a couple times a month or every week. And then we do a reassessment after X amount of times. I don't know, just to kind of give people an idea of, yeah, like what it looks like to virtually work with you and then how to contact you and stuff. But let's start with the myths.
The
So we'll
myths,
start
yeah.
there. Yeah.
Okay.
What are like the top myths that you hear out there about pelvic floor, especially related around like pregnancy and postpartum?
I guess the biggest myth that comes to mind right now is that Kegels are the number one pelvic floor exercise and everyone should be doing them. That is a big myth. This kind of goes back to your previous comment about tightening and releasing. Kegels are not for everyone. And the reason why is because depending on what's going on with someone's pelvic floor, like their baseline, typically if people have a tighter pelvic floor or been diagnosed with a hypertonic pelvic floor, so again, it's like stiff, if we have them do Kegels, which is a voluntary contraction, like a squeezing of the muscle, if we just have those people do that over time, it's just going to keep making the tightness tight. Because it's
Yeah.
like, I already started tight. I'm telling myself to keep squeezing, and you're reinforcing the tightness.
Yeah.
Also, I think Kegels takes a complex muscle group and kind of reduces it to a really simple thing, which I'm a big fan for making things simple. But I feel like the messaging can get lost or there can be false like hope given, if you will, if someone's has pelvic floor issues and they're like, oh, all I have to do is 100 Kegels a day and it goes away. The pelvic floor works with your breathing and your abs and your back muscles and your hips. So if you don't consider those other muscle groups, then you're really not going to move the needle forward when it comes to overcoming these pelvic floor issues.
I have been described to me as you want to make the pelvic floor like supple, like strong and supple.
Mhm.
But you were saying like if you're just like strengthening, 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 and especially going into birth, it's just this really hard thing that's because it's so hard, it's easier to kind of like break in some way versus like a
Yeah.
give and a take, especially during a vaginal birthing process. Since we're on the topic of Kegels, what do you think about yoni eggs?
I guess I have very limited knowledge on them. I feel like I have a simple understanding where it's just like a weighted kind of device that you insert. Is that correct?
It's like an egg shape. Usually they're made out of like a stone, like jade, rose quartz or something, but they're just like an egg shape. And I think for me is it's how have you been taught to use it? Because if you're thinking of
Mhm.
it like a weight, vaginal weightlifting, then yeah, I think it can fall into that line of Kegels. I personally, if people are interested in using them during like pregnancy or postpartum, I always recommend they use them laying down because I think similar to a finger or something, it gives you feedback like of isolation of the different vaginal muscles of okay, try
Mhm.
to like tense and release either if we're looking at the vaginal canal in three sections, the section closest to the cervix and just focus on that one and or like the right side or the left side when trying to really re-relate your body. Like you said, like all these different muscles. It's not just like one up, one down, one up kind of thing. I'm just curious. I'm personally a Yoni egg fan, but I know there's like
Okay.
different thoughts out there around it. And I'm open to hearing of, yeah, no, like generally it's better to just use your fingers. Or I think also incorporating the breath is important.
Mhm.
And like you said, if there's issues, just relearning how to breathe sometimes for people is like such
Yeah.
a big thing. So
Yeah. So going back to like how they can be helpful for how you mentioned awareness and proprioception, I don't really prescribe them or have much experience with them, but if I look at it from your perspective, I could see how that could be helpful in a short-term period. Let's reestablish this mind-body connection. You have this feedback down there. But once we lay that foundation, I feel like we should be able to move on from it or build on from it. In my opinion, I don't feel like a yoni egg is a long-term
mhm.
solution. And then if we kind of transition it to more like the weightlifting side, I'm not the biggest fan of that.
Yeah.
So that's my thoughts on
Yeah.
yoni eggs.
Eggs. Cool. Other myths that people that come to mind and any others that
Yeah.
are big ones?
I guess another myth is that pelvic floor issues are just a pregnancy postpartum issue. It can affect anyone, any gender, any age range, regardless if you've given birth or been pregnant. As long as you have a pelvis, you have pelvic floor muscles, and they could potentially get dysfunctional.
I think also weaving into this, if you don't have symptoms and you don't have pelvic floor issues, because oftentimes I'll tell clients you should definitely go see someone. I like this virtual thing if it's more accessible, because just because you don't have a symptom doesn't mean that there might not be something out of alignment 5, 10 years later. If you're slowly repeating that, something will pop up 3 years later, and it's because of a pelvic floor issue that wasn't spotted after
Yeah.
birth. So I don't know if you want to speak to that at all too.
Yeah. Some kind of sneaky ways that the pelvic floor can pop up is if people have like chronic low back pain or hip pain, just because anatomy wise, they're all connecting to similar areas. So someone might not have the typical like bladder leaking or pain with sex or pelvic pressure, but they've had this long history of low back and or hip pain, and they've tried all the things and it never got better. The checking out the pelvic floor would be like a really worthwhile thing, just because again, anatomy and location wise, there is going to be a lot of overlap there.
I think this is a good lead in, though, of maybe how you work with people because,
Yeah.
again, I always recommend everybody, regardless of how they feel or how their birth went, I recommend, if possible, to work with a pelvic floor therapist at least once. It's good just to see and if something's there that maybe you're not feeling or seeing because it's better to address that now. And so much is shifted during pregnancy and birth, no matter how your birth was, C-section or vaginal. This is a good leeway into how you work with people. If someone's not presenting symptoms, you say you do an initial assessment when you work with people. Are you able to spot those? Even if there's no symptoms present. And then, yeah, like how you generally, it's okay, you have an assessment with somebody, and then how does it generally work from that point on?
I typically begin the process with everyone by scheduling a phone call just so that we see if we're like a good fit together, see if we kind of align based on goals and what you want to get out of the experience. I do a full body assessment, so like head to toe of how your body's moving, how the individual joints and muscles are moving, and then how does the system work together. Big thing with pelvic floor issues is there's a lack of coordination. So certain muscle groups are not firing together. It's uncoordinated. And then the body's like struggling to overcome that like clumsiness, if you will. Just taking a step back and looking at the body from a like full body approach can kind of uncover some of these hidden pelvic floor issues, if you will. And then just going over their past medical history and just like listening to their story, touching, having those like TMI conversations. I'm going to ask you some questions about your bladder habits, your bowel health habits, your sexual health habits, if you're active, any surgeries. It all just comes down to having a conversation with someone, listening to them, and then doing this full body assessment. And then you can get a good idea of what's going on. And maybe there are symptoms that are pelvic floor driven that they wouldn't have thought are.
Do you ever have somebody come to you for like preventative care and you're like, or come to you after a birth, be like, hey, I just want to get this checked out to make sure everything's okay. And actually things are really good. When maybe there's next to nothing as far, I'm sure
Yeah.
there's always room for improvement. And then postpartum, I think there's always some small stability exercises and core exercises you can do. There always is because of like how
Yeah.
pregnancy and birth affect our body. I remember doing the little toe slides while breathing, laying on the
hmm
ground. But do you ever have somebody come and to check out and you're like, actually, your pelvic floor is in a really good position? How does that kind of unfold from there? You probably maybe work with them for a month or two just to make sure they're stable. And then,
Yeah, there are situations where people are in a really good place pelvic floor wise. If we talk about it just in a postpartum lens, like you mentioned, we can always be doing things to improve our body, and consistency is going to be key. Some of the issues I hear women talk about postpartum is they're like, I just don't know what to do exercise wise, what's safe for
Mhm.
my body, what's not. If we are in this situation where someone is not really having any issues and their pelvic floor is in a good place, I can help create an exercise program for them that
Cool.
takes that mental load off their plate of what exercise am I supposed to do? Is this even right for my body? Because we'll do an assessment and we'll figure out like what exercises are good for them based on that time. And then in maybe a month or two, we reassess and progress those exercises and make them a little bit more challenging. So yeah, just coming from like a exercise perspective and taking the mental load off a mom's plate of how do I move my body, that's where it could be helpful for someone, even if they're like, I don't really have pelvic floor issues.
Yeah. Which you don't know. Like I always tell people, you don't know. So always just go, yeah, get an assessment or get checked out. It's just better versus, again, like you said, 3 years down the line, having things pop up. The sooner you can address things, the better it is, especially when your body's in that postpartum, really first 6 months window where it's still really open. They're more supple, I think, easier to work. Awesome. This has been so great. Is there anything that we missed that you want to make sure you say or any like final things?
Yeah, like we touched on a lot of good topics. The biggest thing I want to reiterate is that it's never too late to start working on your pelvic floor. The body is amazing and very adaptable. So even if you've had symptoms for years or decades, we can still make really good changes. So don't feel like that if you miss that window of the 4th trimester or whatever, we can still help out your pelvic floor and help your body years after. That would be the biggest thing I would want people to know that are listening to this.
And it's so important in my mind. It's at the core. It's like at the center of so much in our bodies. If we think about it, this layer, once that's stabilized, it radiates out into so much more of our body. And it's just often so forgotten and overlooked, unfortunately. Great. Do you want to just really quickly remind people how they can reach you or find you or book a call with you?
So Instagram is going to be the best place to reach me. My tag on there is at Dr. Brynn Babb, Brynn. I have a link in my bio if you want to schedule a call there. But really, if you just want to shoot me a DM and we can just start having a conversation there, I'm very active in the direct messages. That would be the best place to reach me.
Awesome. And I'll put the link to your calendar to schedule a consultation call in the show notes too, just in case there's somebody who's listening that doesn't have Instagram. Most people do, just in case, and somebody wants to reach out and schedule a call. And I think you do a free consultation call with people.
Yeah. So the first call's free. That's where we just talk about you, what might be going on with your body, see if we're a fit, and then see if we want to move forward together.
Awesome. Cool. Thank you so much. This has been amazing. Thank you.
Thank you so much for having me. I love talking about this. I think we just need to keep having these conversations.
For sure. And again, if you do have Instagram and you haven't, go check out her Instagram at the very least, because there's so many good tips on there and it's just super fun. Like I could scroll through it all night. I got very lost on there. Thanks so much.
Thank you.
Hey there, amazing listeners. We just want to say a huge thank you for tuning into our convo on the Just This podcast today. We appreciate each and every one of our listeners, and your continued support means the world to us.
If you enjoyed this episode and found value in it, we would be incredibly grateful if you could take a moment to leave us a review on your favorite podcast platform or share this episode with someone you think would enjoy it too. Your reviews and shares not only motivate us, but they also help others discover our show.
We're also all about keeping the conversation going and hanging out with our incredible community. Head over to justthis.site, that's JUSTTHIS.SITE, where you'll find additional resources, ways to connect with us, and join the conversation, plus some more goodies.
Thank you again for being a part of the Just This community. We'll be back soon. Until next time, remember to take care of yourself and embrace the wonder as you navigate this extraordinary adventure.